Welcome to another enlightening episode of Ayurvedic Insights brought to you by we all doctors from Ayurveda Medical College, that is USTM, which is known as IA Ayurveda Medical College. I myself, Dr. Angshumita Choudhury from the Department of Sanskrit Samhita Siddhant, serving there as assistant professor, and with us today we have Dr. Rama Kanta Sharma sir from the Department of Garbha Saskara, and who himself is the principal of our college, Dr. Hashina Mehjabin from the Department of Prasuti Tantra and Sri Roga, and Dr. Meghna Darvatkar from the Department of Sharir Kriya, which is Department of Physiology. Today it's a very special episode with valuable information and engaging discussions ranging from various topics like geriatric care, swasthya care, Panchakarma therapy, Rasayana, which is anti-aging treatment, which then will move on to our Prasuti treatment, which is the gynecological basis of Ayurveda, as well as our physiology of human beings. Hello everyone. As I am from the Department of Sanskrit Samhita Siddhant, which is the core subject of Ayurveda, which deals with the basic principles of Ayurveda. And as we know, the Ayurvedic main principles are like swasthya care, which is swasthasya swasthya rakshanam, that is the prevention of health, promotion of health, as well as cure the bad ones. So in case of geriatric care, which is very prevalent in today's society, where Ayurvedic department is gaining a lot of patients from across urban cities, from semi-urban, as well as from the village areas people. The geriatric care is basically the Jara Chikitsa in Ayurveda, where it deals with the treatment as well as the prevention and arresting the delays the aging process. So here with us today our doctor, our sir, our principal of Ayurveda IA Ayurvedic Medical College, R.K. Sharma sir, our principal of IA Ayurveda Medical College. Sir, in today's world, Ayurveda, like all eyes on Ayurveda in the name of geriatric care, in the name of swasthya care, like promotion of health, prevention of health, anti-aging, we all find like in the name of spa therapy, in the name of other aromatherapy, but the basic behind is all about Ayurveda only. So what do you like to tell about geriatric care?
Yes, fantastic. Geriatric care, it is a very fascinating word, especially for a Ayurvedic physician, for aging people. As because everybody want to stay healthy as well as keeping their healthy level. So for geriatric care, we have many herbs as well as we have some special therapy like Panchakarma, where we have detoxified the bodies and all. So geriatric care, for these herbs we are using like Brahmi and some Medhya Rasayana Oshadis.
Yes, as you told about detoxification and about the elderly people, but we also see the middle-aged group also too. They are very fascinated and very interested to delay the aging process. And if we see scientifically and medically, like oxidative stress and the free radicals also play a very major role in Ayurveda. So, and also like, is there any other therapy or any intake of medicines, like oral medicines, or are there for this promotion of health and prevention of like aging process?
Yes, fine. That you have told that the Panchakarma I have told. No? So in Panchakarma as well as in the Rasayana, both are actually very interrelated. Panchakarma, where we have given specially the detoxifying process. So, there is Samana and Shodhana. So Shodhana process, that is basically in Panchakarma, where we are given the 5 therapy, that is Bhavana, Virechana, Ashtapana and Naisha, etc. And this karma specially just combat these diseases. So and if we use the medicine apart with the various therapy, then it will help.
So as you told about Panchakarma interrelated with Rasayana, Panchakarma, which is one of the very important subject of Ayurveda, it's one of the strength of Ayurveda. It deals, that means Rasayana deals with both mind, body as well as soul.
Yes.
And like for detoxification of body, there are various guidelines, there are various diets, regimens, medicines, therapies in Ayurveda. And with us today, Dr. Meghna Darvatkar from the Department of Sharir Kriya. Let's learn from her and get some valuable insights about how diets and regimens help in swasthya care, how diets and regimens, keep your body healthy and swasthya.
So right now in this era, this 21st century is very much approaching towards the Ayurveda. It is just because of the lifestyle changes what happens with the people, and for the convenience of life they have changed their food habits and the lifestyle according to the modified work schedule, and due to this the sedentary lifestyle disorder may happen. So due to this hectic schedule they have changed their lifestyle and their diet also. Due to the sitting working schedule they have lead to the sedentary lifestyle disorder, which in which the women are involved in 90 to 100% almost, we can say. To overcome all the sedentary lifestyle problems, one has to follow the rules and regimens based upon the Ayurveda, which basically follows the rules for the food, proper food, and the timings for sleeps, and the work schedule to be changed by the sitting working schedule has to be changed to the moving schedule. That is what the person has to follow, the exercise also and the proper diet also.
Exactly, that means you want to say about Ayurveda deals with body constitution and very whole patient care, where the public demands that treatment only nowadays. So now, as we are talking about diets and regimens in Ayurveda, the geriatric care, the Rasayana therapy, sir told about Panchakarma therapy, the body constitution therapy, the Prakriti. We also have with us today Dr. Hashina Mehjabin from the Department of Prasuti Tantra and Stree Roga, where diets and regimens also play in Sutika Paricharya, in Stree Rogas, in the adolescent childhood, as well as during the menopause, during the early menarche, like that. So, Dr. Hashina Mehjabin, I would like to ask you about the diets and regimens that a pregnant mother, in the 9 months is a very crucial. So, what Ayurveda deals with the diets and regimens in pregnant women?
Thank you, Dr. Angshumita. You mentioned a very desired topic nowadays, and which is much need of the hour. This diet and regimen during pregnancy is a very important thing, and it is a very important part of Garbha Sanskara. As we all know, Garbha Sanskara is a very ancient practice, and it is scientifically proven also, but it needs to be promoted in this 21st century. So in a simplified way, I would like to mention Garbha Sanskar. Garbha means the child that is in the womb, and Sanskar is how can we, means it's a kind of processing. How can we inculcate some good qualities in the child? So Garbha Sanskar, if I ask you one question, you think you are pregnant,
Okay.
and what qualities you would like to see in your child? Just
We would like from the nourishment of the body, from nourishment of the even mind, brain development.
if I ask you, and we have seen 99% of people says they want like color should be fair colored,
Yeah,
intellectual,
definitely.
sharp mind, good in
Sharp-minded.
studies. These are the most
Yes.
desired qualities,
That's
right, sir?
what, yes. Brain development.
Yes.
Yeah.
So that is not Garbha Sanskara. Actually, mostly people are focusing on the physical quotient and the intellectual quotient. But Garbha Sanskara also includes the mental quotient and the spiritual quotient,
Yes.
which is very much missed out by the people. We only focus on the materialistic things, only the look, appearance for our child, and just on the intellectual thing. But we forgot to this
put stress on the
stress on the
mental well-being,
exactly. Mental
development,
development
as
of the
well as
mental thing and the
exactly.
spiritual thing, which is also
Exactly.
equally important.
Yes. And Ayurveda is a holistic
Yes,
care. You
yes,
know, it deals all
exactly.
with mind, body, soul, everything. Yeah.
And I would also like to mention Garbha Sanskar doesn't start from the day the women get pregnant,
Yes.
but it is a kind of pre-conceptional counseling also.
Okay.
I would like to mention you all. It actually starts right from the when a couple is planning a pregnancy.
Mhm.
It's a kind of preconceptional counseling thing, care thing, where we take 3 to 6 months of time.
Exactly.
Any bad habits the couple is having, we want to
Exactly.
withdraw during that time.
Exactly.
And another very important thing is the Vija Shuddhi. As Sir mentioned, the Panchakarma that plays a very important role during that period. We used to do detoxification of the couples during that 3 to 6 months of time, so that the seed we get from both the partners are at its best quality.
Yes, very
And
interesting.
yeah, best quality, and the genetic material that will be transformed to the child will also be at its best. That is the thing. And regarding Dr. Angshumita, you asked me about the importance of food.
And
Food and diet.
during the
That
entire,
is also a very beautiful topic. It is Mas Anumashik Garbhini Paricharya. All the food habits, food and diet, and what are the activities, yogasanas, specially mentioned for each and every month.
Yeah.
It differs
Yes.
from each and every month, so that we get a very healthy child in our hand.
The rasas, the gunas of the medicines,
yes,
the foods
yes,
also
yes.
differ in every month.
Every month and
Right
everything.
from first month to ninth month. Yes.
And
yes.
80% of the development of the fetus, this brain take place in the womb itself.
Yes,
So
exactly.
it subconsciously takes up everything from the mother. And we heard about that Abhimanyu, right?
Yes, yes,
Yeah.
exactly.
That Chakravyu
Yes.
thing. That is one. That is on Garbha Sanskara. That was done at that time only, because when the mother slept, he forgot how to came out.
Yes, the last one.
Last one, na? he get to know how to get in, but he forgot how to get out because the mother slept at that time. That's it.
Really, whatever you have addressed, actually, this is the beauty of Ayurveda, that where we are just discussing regarding the Garbha Sanskar as well as the Masanumasik development. So this development is actually very miraculous, as well as we have to take care. Fine.
Thank you, Hashina Mehjabin. It was a very insightful thought by you from the Department of Gynecology. Today, we have learned about a bit, if I say today, because it's not possible for us to cover so much, like right from geriatric care, our body constitution, according to that, how the diet, how the regimen, how Panchakarma affect us, how Rasayana therapy affect us, how the anti-aging, how the promotion of health, which the main aim of Ayurveda, the swasthya care, because Ayurveda tells atura swasthasya swasthya rakshanam aturasya vikara prashmanam cha, which means first let's promote the health, to prevent the health from any disease causing, and if the second one is if any disease arises, Ayurveda is very fruitful in that. So Ayurveda, we all know it's a very burning thing. Now we can say the public is all eyes on Ayurveda. If I say it's not wrong. So IA Ayurveda Medical College gives you different branches. There are doctors. You can come here for fruitful treatment. As our principal sir is with us today, we would like to know further and in detail a bit, if you can provide us some insights, like what are the scenario that is happening in Ayurveda College.
Yes, today we are just concentrating specially the patient care. In IA Ayurvedic Medical College, we have a attached hospital that's known as very popular name is UHAN, and we are giving the service in all the sector, right from the gynecology, obstetrics and gynecology, then these pediatrics, then medicine, surgery.
Panchakarma also there.
Yes, Panchakarma is there, and we have many patients, but we are very adjacent to the Guwahati city, and it is known as Bridwa,
Yeah.
the
Bridwa
area of
district.
the 9 mile.
9 mile.
And so I just request all the viewers, please do come. All our young doctors and they energetic. They are always helping the people, and most of the people they are very beneficial with this treatment, and especially the Panchakarma. We have a very special care on that. So hope will be benefited.
Yes, and then get the goodness of Ayurveda over
yes,
here,
yes,
right?
sure.
Okay. So thank you so much today. Thank you.